My guest today is Greg Salinas, president of CE Outcomes. Greg, I'm really glad that we're talking at this point because some things have come to my attention that I wanted to pass by you as an expert in this space. I'm personally pleased that there's a growing trend now to get the patient and the caregiver's voices in steering committee meetings, on stage at live meetings, as well as in online educational presentations for clinicians. And that's a relatively new thing. So let's talk about how important it is for clinicians to hear and pay attention to the voice of the caregivers and the voice of the patient.
As we're all growing and we're all adapting to the modern way of thinking about things, is that there was often a missing voice there. And that was the voice of the actual patient and the actual caregiver, and the people that have to deal with all the stuff that happens between the appointments, right? You might be 6 months, might be a year between seeing a particular healthcare provider. So what happens in that time? And having that understanding to the clinicians of what actually these patients and caregivers are going through, with representatives on stage and with perhaps advocates of patients as well, to discuss that and make them think or help them think about the decisions they make and how that impacts real people.
Can you talk about any way that you've seen this new construct of partnership between patient and clinician, how it's helped specifically?
With the concepts of shared decision making now is becoming a little bit more commonplace in the medical education world, about how you think about sharing that choice and making you both come, the physician, the medical staff, the patients, the caregivers, all come together and agreeing on a treatment. And that seems to really help with things like adherence to medication. So understanding that if I do this and if I follow this plan, this is going to help me. I had input into the plan. So it makes it a little bit more, I guess, digestible sometimes for the patient, for the caregiver, to understand, okay, I'm a part of this plan. Here's my role. Here's my job. I have to take this, let's follow this plan. And to get them involved in that on the planning portion of it is hugely helpful. It's not just a authority talking down to a patient, but really that back and forth of information that really seems to help and seems to improve patient outcomes.
Why is it important for patients and caregivers to participate in disease-specific surveys?
There has to be an understanding of what the gaps are in education, what the needs are of a community before you go about designing education for them. Otherwise, there's no chance that it's going to do anything. If you want to have the most efficient, the most effective education, you have to understand the problems of a community first. So this is why we put on these types of surveys. We're trying to, in a scientifically rigorous way, of going out and finding what those problems are and trying to get it from the real people who are going through this every day.
Hey, Greg, what surveys are you presently involved with?
So we have 2 studies going on right now. One trying to understand the needs and some of the issues faced by patients with small cell lung cancer. And we have another one for both caregivers and patients in the area of myelofibrosis. So, both relatively rare therapeutic areas. So it's a little challenging finding these patients, but their voice isn't any less important. So it's really trying to find these people going through this to understand what their current barriers are to care, how they're experiencing their care, what do they know about it, or what do they feel like they need to know, and also where do they want to go for education, and where can we maybe put the best education we can to get it seen by these groups.
And the more they are able to respond in these particular disease spaces, especially if they're rare, the better it is for them and their loved ones, I think.
Yeah, it's giving them that voice and really knowing that their opinions and their experiences, as they feel comfortable inputting it into these surveys, are going in aggregate. Not no one knows the name of the people that are saying these things, but it's going to the people that are actually putting on the education and supporting the education and are really doing their best to provide the best education they can for this community.
it's so true. The most important thing you can do for your loved one is to be an advocate, have your voice be heard, and make sure that the system is working in their best interest.
If you add up all the rare diseases, there's quite a few people with rare diseases. So it's something that might fly under the radar. So it's maybe even more important for these educators, et cetera, to understand what you're going through, because it's a little harder to find that voice.